Thank you so much for joining us. We are so glad that you have joined us. I'm going to get us started and share my screen here. I actually do have, getting started here in just a minute. I have my, there we go. All right, can you see my screen, Ashley?
No.
All right. Can you see now? All right. Thank you so much, everyone, for joining us this morning for our webinar on structural inequality and the COVID-19 pandemic. My name is Kimberly, and I'm on the training team here at Indivisible. And I'm joined by my colleagues, Judy and Ashley. And we're so honored that you joined us this morning, it's morning still, to talk about how structural inequalities in our country and really around the world is leading to really devastating impacts on poor and marginalized communities. We really do have a bold statement to make, and that's that our system is not broken. It's functioning the way it's supposed to be. And that is benefiting the rich, wealthy, and white, and treating other folks' lives as expendable. And we'll be spending today's session talking about this and exploring this idea, especially in the light of the COVID crisis. Okay, my screen, there we go. So people want to talk about this crisis as an equal opportunity pathogen, as we know, but it's really not. All we have to do is look at the news and see what's happening in poor and marginalized communities. We can look at the impact of what's happening on reservations and in the Black community. And we can see that it's going right to the existing fissures in our society. And so today we're going to look at at the structural inequalities and how those structural inequalities got us here today. We're going to explore how communities are impacted differently by COVID-19. We're going to just explore what we can do together, both in the short term and in the long term. And we're going to explore, does policy have the potential to function as a form of violence in our society? But before we do that, we know that there's a lot going on right now. And we want to take a moment to honor where you are. And we want to acknowledge the first responders who are working to take care of those people who are impacted and who are sick and in the hospital. We want to honor those people who are dealing with COVID right now, who have family members who have been stricken with this illness. We know that there may be people on this webinar right now who have family members who have died, and we want to honor where you are. Our indivisible family has, our indivisible staff family has family members who have been impacted by this virus. And so we want to honor those of you who have been impacted. And so what we want to do right now, I'm turning my iPad off, I'm sorry for the background noise. We want to do a collective check-in to see how everybody's doing. And the way we're going to do that is to respond to a collective prompt to see how everyone's doing. I'm going to ask you to respond this poll question using a new tool that we're trying out today called Poll Everywhere. You're going to respond to the poll question, what one word best describes how you're feeling right now? And in just a moment, I'm going to go to the poll and you're going to start seeing responses populate the poll in real time. You can participate in the poll by going to pollev.com/indivisible2028. That, by the way, is going to be the year we just finished with our second term in the White House, by the way. Or you can text Indivisible 2028 to the number 22333. Now you only need to text this once to join, and then text your message. So the prompt is, what one word best describes how you're feeling right now? If you start responding now, I'm going to go out to the poll and you'll be able to start seeing what people have already started to say. I'm going to go out to that poll now and you'll be able to see how people have started to respond already, and we'll see how people are feeling. Oh, we've already got some responses here. Let's see how people, oh my goodness, we can see that people are feeling, a lot of people are feeling stressed. Yes, I can certainly relate to that. I've got a 4-year-old that I'm stuck in the house with. People are feeling privileged and worried and overwhelmed and tired and privileged. Someone's feeling white, okay, and overwhelmed and afraid. All of those feelings we want to honor, and we're with you. And so now we're going to get started talking about structural inequalities. And my friend Judy is going to talk to you about that. Thank you. Judy.
Hi, if we could have the next slide, please.
Yes, getting that right now.
Thanks. So my name's Judy Statman. I work with the Indivisible organizing team and just want to thank everyone for joining us for this really important conversation today. One of the core concepts we'll be using throughout this discussion is structural inequality. Structural inequality is defined as a system of privilege created by institutions within an economy, including law, government policies, business practices, and education, among others. Inequality is structural when policies, practices, and employment conditions consistently prevent some groups of people from obtaining the resources they need to better their lives or simply to make ends meet, and then consistently delivers a greater share of benefits to the most privileged groups. Structural inequality ensures that privileged groups can use their power to enact policies that protect their wealth and status while excluding others from having the political power and resources they need to improve conditions for their families and communities. Structural inequality is deeply woven into the very fabric of American society, and it's baked into the foundational ideas that people in power use to justify today's status quo. Most of us are familiar with some of the ways structural inequality shows up along lines of race, sex, ethnicity, ability, class, and other characteristics of our humanity. Under the system of structural inequality, all the institutions of our society, including our public policies, function to keep the group in power permanently safe and secure, and make other people and communities permanently unsafe and insecure so they can be easily marginalized and exploited in the economy. So what exactly do we mean when we make the bold statement that social and economic policy can function as a form of violence in our society? In order to talk about the impact of structural inequality, first I want to define what we're talking about when we talk about the term dominant group. When I say dominant, what comes to mind to you? Go ahead and type it into the chat box. So I see a lot of responses here. People are saying power, people are saying privilege, someone is saying white male. I think it's absolutely true that our concept of the dominant group is informed by white male supremacy. So all of these things are certainly aspects of what it means to be part of the dominant group. A dominant group means the people in a society who possess extraordinary wealth, power, and privilege, and can use their status and resources to protect and expand their dominance. An easy way to think about this is that the dominant group is the group of people in a society that has the power to make the rules. And then they make the rules to protect their power and privilege by reinforcing structural inequalities. So then structural inequality guarantees that policy decisions benefit the dominant group over others. The results can disproportionately be disproportionately harmful and even deadly to folks in marginalized communities. If we don't take action to correct the way our state and federal policies reinforce inequality by causing disproportionate damage, deprivation, and loss of life over and over again in affected communities, we then allow policy to function as a form of violence against people and communities the dominant group considers expendable to their political and profit goals. Today, we're talking about how structural inequality is presenting in the COVID-19 crisis. But there are many other examples. You can see also how this dynamic plays out in the controversy surrounding the statement Black Lives Matter, but also, looking back at recent history, we can also see how structural inequality was a huge factor in the outcome of what happened in the response to Hurricane Katrina in 2015. So what do we know about how we stay safe and avoid exposure in the coronavirus? And before we dive into deeper policy discussion, I just want to review a few things we know about how people and communities can stay safe and prevent the spread of coronavirus, because these things matter to how we see structural inequality impacting health outcomes. Because there is not yet a vaccine or effective treatment for COVID-19, the only way for individuals to reduce the risk of infection is to avoid exposure. So what are some of the ways that folks are avoiding exposure? Go ahead and type them into the chat box. I already see there are a lot of responses there. People are saying, wash your hands, social distancing, work from home, all of those things. So that is exactly right. The most important steps we can all take to avoid COVID-19 exposure are to wash your hands a lot, really a lot. Do not touch your face, avoid crowds and close contact with others. Stay at home if you are in a high-risk population, and quarantine if you are sick, or if someone you live with is sick. Practice social distancing, and if possible, work from home. And if you must work in an essential business, use protective gear to reduce your exposure. Of course, not every worker can work from home, and millions of low-wage workers in the service sector are designated as essential workforce and must go to work whether or not their employer is following CDC guidelines for protecting the health and safety of essential workers. Overall, only 30% of US workers say they have jobs that let them work from home. Essential workers include food supply chain workers, including farm workers and meat and poultry processing workers, factory, warehouse, and transportation workers, workers in essential businesses like grocery stores, pharmacies, and building supply stores, and of course, essential health and public safety workers, not just first responders, doctors, and nurses, but also low-wage maintenance and cleaning staff, food service workers, and direct caregivers in hospitals and long-term care facilities. And as you can see from this chart, there are differences across race and ethnicity, mostly because of occupational segregation, which is another product of structural inequality. There's also strong evidence that individuals with underlying health conditions like diabetes and heart disease are more vulnerable to serious complications from coronavirus and need to take extra precautions to reduce risk of exposure. So as we talk about the policies we have and the policies we need to reduce the impact of structural inequality on outcomes of the COVID-19 pandemic, keep these things in mind. Now I'm going to pass it to Ashley, who is going to talk about the policy decisions that have brought us to where we are now.
Hey everyone, so thank you Judy for that explainer. I want to emphasize that while COVID-19 has been the spark to light this public health and economic crisis, the crisis we're in is a result of government systems designed to privilege the white and wealthy. Without understanding how our policies were designed to intentionally harm certain groups, we can't work to change them. Next slide, please. Government policies have often targeted certain communities of color. For example, throughout American history, Black Americans have seen their voting rights attacked. First as enslaved people who enriched white landowners, then under Jim Crow laws meant to restrict Black political power. And today, in the form of voter suppression, tactics like strict voter ID, voter roll purges, and the targeted closures of polling locations. These are policies that are intended to undermine the political participation by Black and brown people, and they can have dire consequences. So can you think of any other ways that racism has been incorporated into our systems of government? Type them into the chat box. Oh, I'm already seeing some answers pop up. So redlining and housing discrimination are both really good answers. Our whole system of policing, war on drugs, war on crime. Yes, lots of, as you can see, there's like a plethora of examples in how our government has discriminated against racial minorities. Oh, the immigration system, also a great example. So in addition to creating racist systems that discriminate against people of color, our government also favors the wealthy and corporations over people. Next slide, please. The privatization of public services, corporate deregulation, and the gutting of the social safety net have all contributed to line corporations' pockets while harming their workers. So for example, the Trump tax cuts, so there the wealthy were given more money, and the result is that we defunded vital government programs. And the privatization of prisons, the living standards within prisons decreased, profits for the prison industry increased, and the demand for prisoners increased as well. And finally, the deregulation of government agencies like the Environmental Protection Agencies saw protections for regular everyday Americans decrease, things like pollution increase, and profits for industry increase. Next slide, please. So finally, while we won't go into detail today, our democratic institutions have also been set up to concentrate and maintain power in the hands of those who already hold it. It's important to note that our democracy was founded by and expressly for white male landowners, and so we're still working with those systems today. For example, the Electoral College takes democratic decision-making power away from the majority of people and hands it to an overwhelmingly white rural minority. And Congress was moved slowly to prevent disruption of the status quo. And think about how long it takes for any kind of large package to be sent through Congress. And we're only seeing it happen in the COVID crisis because we are literally in one of the largest crises we've seen in recent times. So we're now going to dive into how this is all playing out in terms of our access to healthcare and our economy. And if you have any questions, please feel free to put them into the chat box and we'll answer them at the end of the webinar. So our private-based healthcare system often puts profits over people. Next slide, please. The US spends 2.5 times the OECD average on health expenditures. So the OECD is the Organization for Economic Cooperation and Development, and a lot of different countries are part of this group. And so as you can see on the graph, the United States spends way more money than even the second country, which is Norway. And to add on to all of this, we don't even have the highest quality healthcare on average. And this leads to the huge disparities we see in health across America. Healthcare institutions often ignore the immediate needs of their communities because they're incentivized to provide high quality healthcare to the wealthy and those who can afford it. At the same time, providers across the country are forced to close from lack of funding, leaving many communities without quality healthcare options. Next slide. For many Americans, public health insurance options like Medicare, Medicaid, or subsidized coverage through the Affordable Care Act are people's only options. But Republicans have continuously tried to defund or destroy these vital programs. So for example, Trump has continuously threatened to repeal the ACA or slowly defund it, and Republican governors have often refused to expand Medicaid, hurting their most vulnerable constituents. These problems are particularly acute for communities of color, and especially Black, undocumented, and Native communities. People in communities of color face challenges to their health, whether it's difficulty accessing competent care, environmental racism, the long-term health impacts of daily exposure to racism, and more. These factors manifest in higher rates of chronic disease, infant and maternal mortality, and negative health outcomes that increase their vulnerability to other health issues. And if we see on this chart here, Black, Hispanic, and Indigenous Americans are more likely to have these underlying health conditions like asthma, diabetes, and heart disease. This is important to understand in the context of COVID because Black, Native, and undocumented communities aren't inherently more vulnerable to disease, but our policy choices and societal attitudes have made these communities more vulnerable. And so as we can see in this graph here, Black, Hispanic, and Indigenous Americans are more likely to not see a doctor due to cost, and Black and Hispanic Americans usually don't have another source of care when sick besides the ER. And so as you can imagine, this really prevents these communities from seeking care when they need it because of cost or even just lack of access. So now we're seeing these systems collapse under the crisis. Next slide, please. In particular, our privatized health system that ties healthcare to employment has put a double burden on anyone who has been laid off. Uninsured people are afraid of the costs of testing and treatment, meaning they're more likely to not go to the doctor and unintentionally spread the disease. And again, we're seeing that Black, Hispanic, and Native Americans are less likely to have insurance. And this is, again, adding to rates of COVID spread because when people don't have insurance, they can't go to the doctor, they can't get treatment, they can't get admitted to get quarantined, things like that. So, worker protections. Since the start of the Industrial Revolution, unions have played a key role in allowing workers to stand up for safer working conditions and better pay and benefits. So it's unsurprising that Republicans have systematically destroyed labor protections and made it harder for Americans to unionize. Next slide, please. This has made it easier for companies to destroy workplace protections for workers, decrease benefits, and create lower quality jobs without reprisal. And as we can see on the map on the slide, states in red have anti-union right to work laws and states in blue do not. And what we find in these states that have right to work laws, just in general, across the board, there are lower wages for people in unions and people out of unions, and also that there are less workplace protections in place on the state level. So this just makes it an unsafe, makes workplaces less safe for workers. And we can see that also during the COVID crisis. Next slide. The lack of worker protections disproportionately affects the working class, immigrants, and people of color. Compounding on this is the racial disparity in job type, which Judy alluded to earlier, where white people are more likely to hold jobs that they can work from home and are less likely to need public transportation to get to their jobs. And during COVID, we've seen an increase in union activity, particularly among gig economy workers and people of color fighting for better pay and safe working conditions. And here we're seeing again, Black, Hispanic, and Native Americans are more likely to be below the poverty level, more likely, we can extrapolate from this, more likely to have jobs that don't have safe workplace protections, or not, are unlikely to have benefits like paid sick leave and so on. Next slide, please. So as with worker protections, the American safety net has been intentionally hollowed out by decades of policy choices aimed at benefiting the privileged wealthy. Conservatives have hijacked safety net messaging, portraying those that need SNAP benefits or Medicare, especially women of color, as lazy. They leverage this to defund vital programs and give tax breaks to the wealthy. The result, no universal health care, decreased SNAP benefits in Social Security, disability services, and no mandated paid sick leave. These are programs that are the norm in most of the industrialized world. And so as we can see on this graph, since we do not have mandatory paid sick leave, the people who have higher income jobs are more likely to have paid sick leave than those who do not. And again, this is causing inequalities within the COVID crisis, because if you have paid sick leave, you're probably likely to take it if you are sick, be able to get treatment, go to the doctor. Whereas if you don't, you're probably going back to work, potentially spreading the disease again unintentionally, and or not being able to access treatment because you have to go to work. So our system has been laid bare by the COVID-19 crisis, as many families find they have nowhere to turn, even as the government gives trillions of dollars away to corporations. And so this is the end of the policy section, and we're going to move on to some about people who have suffered from this COVID crisis. But what I want to leave you with is this. While COVID-19 is what set off this public health and economic crisis, it could have been any shockwave to our society. As we've seen throughout this presentation, because of structural inequality, our system was primed for disaster. It could have been any major shock that produced the same results.
Thank you. Thank you so much, Ashley. Mothers, our daughters, our sisters, our brothers, our fathers, our neighbors, our favorite clerk at the 7-Eleven or the coffee shop. Just beneath the policies that Ashley and Judy just talked to us about are people that these policies are supposed to help. But the hard lesson and the hard truth that we're learning through COVID-19 is that when policies fail, sadly, people die. In just a moment, Judy is going to share with us some of the stories that we've probably heard about in the news. As you listen to these stories, you're going to reflect on some of the policies that we've talked about and some other policies that might have made a difference in the people's lives that you're going to hear about. And as you listen, we'd like you to participate in one other poll activity with us. You're going to respond to the poll at the same, and we'll put up the polling information in just a moment, but you're going to listen to the poll and respond and share with us what policies might have made a difference in the people's lives. So you're going to go back to the poll where you went before, the exact same poll, and you're going to respond A, B, C, or D, and let us know whether you think healthcare, social safety nets, healthcare, corporate policies would have made a difference in people's lives. And you'll be able to see in real time whether, as Judy reads, whether those policies would have made a difference. All right, so Judy, would go on and get started, and I'll put the poll up once you get started.
Thank you, Kimberly. I'm going to share several stories which viewers should be advised contain some disturbing and heartbreaking content. As I was looking for these stories and researching what was happening, it just is really sad. But before I get started, I want to be really clear that there are a lot of things we still don't know about why or how much the COVID-19 pandemic is having different impacts on different communities. And we probably won't know the full scope of that for a long time. But if you think back to the very few options everyday folks and essential workers have to lower their risk of exposure, we can start to see how structural inequality impacts access to personal safety, as well as access to economic and job security. Here's our first story. On March 21st, Detroit bus driver Jason Hargrove posted a strongly worded selfie video calling out a passenger on his bus for failing to cover her cough and pleading for bus riders and the public to take the COVID-19 pandemic seriously. Folks are dying out here because of this, he said, adding that his only option to protect himself from droplets from the passenger's frequent coughing was to close my mouth. He said, "I closed my mouth." Just days before Jason posted about the incident, Detroit transit workers had staged a walkout demanding that city authorities do more to protect their health. 11 days after posting the video, Jason Hargrove, a 55-year-old married father of 6, died from complications of coronavirus. Our next story is Annie Grant. Annie Grant was 55 years old. She was a 15-year line employee at the Tyson's Food Poultry Processing Plant in Camilla, Georgia. Annie had been running a fever and had been out sick for 2 days when her employer ordered her to come back to work. Annie reported for her shift, but was too ill to work and went home and was soon thereafter hospitalized. After a week on a ventilator, Annie Grant died from complications of coronavirus. A second line worker from the Camilla processing plant died the same day. Food supply workers are designated as essential workforce by the federal government. Meat and poultry processing plants where hundreds of low-wage workers stand elbow to elbow to do the work of cutting, deboning, and packing chicken, pork, and beef have become epicenters of coronavirus contagion in the communities where they operate. Several large plants have shut down as a result of hundreds of employees at a single location becoming infected with COVID-19. And there are more and more news stories about meat processing plants closing down because of spread of the virus. At some plants, workers have staged walkouts over concerns that they are not being properly protected, but many remain on the job, most of them Black, Latinx, and immigrants. Our third story is for Wando Evans. Wando Evans was an overnight stocker and maintenance associate at a Walmart in Evergreen Park, Illinois. He died on March 25th of complications from coronavirus, 2 days after being sent home from work. A coworker at the same time, Philip Thomas, died of COVID-19 related illness 4 days later. Wando Evans' family decided to file a lawsuit against Walmart, claiming that the company failed to inform workers about the spread of COVID-19 symptoms among employees or to safeguard them with gloves or other protections. The family's attorney posted on social media that when his firm took on the case, we were trying to help the Evans family get answers. We now have Walmart employees from around the country thanking us because Walmart finally stopped ignoring their employee requests and are attempting to follow CDC measures to protect its essential workers. Although it took 2 deaths at the same Walmart, it's never too late to start implementing safe procedures. Walmart is the nation's largest employer with 1.5 million employees in the US and over 52,000 employees in the state of Illinois. The company's pay range for overnight stockers is $10 to $16 an hour. The privately owned corporation's net worth is $514 billion. So now we're going to look a little bit at the interactive poll that you've been participating in. We see that a lot of folks called out worker protections as something that would have helped these essential workers in protecting their health and their lives. Corporate policies that put people over profit. Yes, exactly. I think, you have a huge corporation like Walmart that provides jobs for so many people in the US and, really not picking up what they need to be doing in order to keep their workers safe. Stronger social safety nets and access to healthcare. I think in a lot of these stories, those are policies that are more hidden behind the stories. I think if we had stronger social safety nets, people who were sick could stay home when they were sick and not be afraid of losing their jobs when they let their employer know, no, I am too sick to be there. And access to healthcare, I think is, that relates to sort of ongoing conditions that, people, may need treatment for that make them at higher risk for COVID-19 complications. So I think these are all great answers, and thank you for participating in the poll. Before we move on with our discussion, I just want to call out that there are important groups of people who are deeply impacted by structural inequality and face increased risk of COVID-19 transmission and complications. That includes America's 2.5 million low-wage farm workers, including an estimated 1 million undocumented workers who are designated as essential workers but receive no benefits under the coronavirus relief packages passed by Congress. And undocumented workers are also still fearful of being, picked up and detained for and potentially deported. It's not that those fears have abated, that's just another spot of anxiety for the farm workers who are undocumented in this country. Unhoused communities and people who rely on, could we have the next slide, please? There we go. Unhoused communities and people who rely on group shelters for temporary housing are also at higher risk for exposure to the virus and serious complications if they become ill. Where I live in New Hampshire, there's been some interesting reports in the last week that people in unhoused communities are actually moving out of shelters and setting up camps in places where in the woods and other places, because they want to avoid the crowded conditions that make them more vulnerable to coronavirus infection. Next, there are hundreds of thousands of asylum seekers held in US detention centers, both children and adults. There's been a very news breaking about a group of children being held in an Illinois facility that have been exposed and have been tested positive for coronavirus infection. And then finally, the 2.3 million incarcerated men and women in the US, the conditions of incarceration are just not compatible with the level of social distancing that's needed to stay safe and healthy. Now I'm going to pass it back to Kimberly, who's going to talk about why this moment calls on us to embrace the politics of solidarity.
Thank you. Thank you, Judy, so much. I'm so touched when I hear the stories of people who are impacted, because when we talk about policies, sometimes we forget that it is about people, and no one can talk about the people better and the politics of solidarity really better than the Reverend Dr. Barber from the people, Reverend Dr. Barber from, I'm sorry, from than the Reverend Dr. Barber. And I want to share with you from the Poor People's Campaign. I'm so sorry. I want to share with you just one quick quote from Dr. Juliet Hooker, who talks about the politics of solidarity. And she says that it's really the reciprocal relations of trust and obligation between citizens that are essential for a thriving civil government, or it should be. That it is, or it should be, the basic goal of all political communities. And right now we're going to share a short clip from the Reverend Dr. Barber from the Poor People's Campaign, where he talks about structural inequality and the COVID-19 crisis. And he talks about Dr. Martin Luther King Jr.'s quote about solidarity. And he references the quote that we must live together as brothers or perish as fools. And I'm going to see. Sorry, just share my screen here. Are you able to hear? How's the sound?
No sound.
No sound. Again. One moment, please. We are destined to have a gremlin every time we share this video. I don't think we're going to be able to share the video.
It's immoral.
It is not lost on you in North Carolina, and it's not lost on me in New York, that the rate of infection among African Americans in counties that are majority Black is 3 times higher than in counties where the majority is white. The rate of death, the mortality rate, is 6 times higher in Black majority counties. What does that tell us?
It tells us that the structural realities and inequalities that existed before this pandemic, that put people in a position where they had the least amount of health care, the most amount of pre-existing conditions, because of the way in which the things that could stymie those realities are meted out in such racially divisive and unjust ways. In a pandemic, it then gets exposed. This pandemic is saying, though, to us, something that Dr. King said a long time ago. We either learn to live together as brothers and sisters, or we're going to perish together as fools. So while it may be 6 times higher, guess what? All of those people that get overly infected, those percentages, they hurt the Black community, but it also keeps the pandemic alive in the larger community. That's the difference with a pandemic. Some other forms of racism, you can kind of keep it isolated. You know, you can keep that racism kind of over there in that community or that housing area, or you can redline that area, or you can voter suppress that area. But a pandemic is different. If you allow it to spread like that and don't address the structural realities that put people in what we call predisposed, that make them predisposed, then it actually allows the pandemic to have a greater foothold in the larger society. So this is the question I'm asking people now, and I'm wrestling with myself because I have my own immune deficiencies. If you knew that you had 48 hours of breath left, because that's real for people who get this disease, that they may, that if they contract this disease, in 48 hours, they could be on a ventilator, no longer breathing under their own breath. If you knew you had only 48 hours of breath left, what kind of world would you use that breath to fight for? Would you fight for a nation where people at least can be guaranteed that their water's not going to be cut off, that they have a living wage, that they have health care, that they have basic affordable housing? What world, what kind of justice, what kind of love, what kind of truth would you fight for if you knew you only had 48 more hours of breath left?
All right. So thank you so much for your patience in our technical difficulty with that video. And we're going to just take about 2 minutes to respond to that question that Reverend Barber so eloquently asked us. And if you take about 2 minutes to go to that, go back to polev.com to our training poll and respond to that poll question. You'll see it right there at our website on polev.com. You'll see the little blue world and respond to the poll question that Reverend Barber asked. If you only had 48 hours of breath left, what kind of world And what kind of policies would you fight for? As soon as you get started responding to that poll, we're going to share the poll and see some of your responses. And then Ashley is going to come back to us and tell us what we need to do in order to get started fighting for those things. Thank you. I'm going to give it, oh, I think people are already responding. Yes, I'm right, yes. Here to where, and we see people are responding. What kind of policies? Righty. Healthcare. Okay, we're seeing healthcare. We're having some problems with our poll here. All right, we're going to come back and share some of those poll responses with you. And we're going to turn over to Ashley, and she's going to talk to you about what we can do. And we're going to come back and share some of those poll responses for what kinds of things you would like to fight for. We're going to end our presentation with those things. Ashley, what can we do now?
Thanks, Kim. So in the spirit of acting in a politics of solidarity, I wanted to talk about what we're doing to combat the COVID-19 crisis and how to make sure everyone is able to benefit. So as we've discussed previously, next slide, please. Today's recession is more than just a result of COVID. It's the result of decades of policy choices meant to benefit the wealthy and leave the rest of us behind. To recover, we need structural reforms that address both the here and now and the root causes that led us to where we are today. We need to act together to address climate change, worker protections, immigration, our democracy, healthcare, and more. All issues are interconnected, and it's going to take massive change to build an economy that works for us and not corporations. Recently, we've been asking you to call your members of Congress and demand a people's bailout. The people's bailout is a framework meant to tie together all the things we need to restructure. It doesn't touch on every single policy choice we need to make, but it provides us a lens through which we can pursue meaningful change. Next slide, please. So I'm going to read out a quote from the People's Bailout website, and it's a little bit longer than what's on the slide, so if you don't start hearing those words right now, it's okay. So what is the People's Bailout? A people's bailout should be rooted in justice. We demand the bailout provide a just recovery by prioritizing and funding those who have been hit first and worst by COVID-19 and the current recession, including but not limited to Black, Latinx, and Indigenous communities. We will not permit Congress to leave anyone behind, not our working communities, our healthcare workers, caregivers, farm workers, other essential workers, Black and Latinx communities, undocumented immigrants, Indigenous peoples, or people who are homeless or housing insecure. A people's bailout should include short and long-term recovery. We demand the bailout address outstanding urgent needs, including health protections and economic relief for all, while also making a down payment on our future. This means higher wages and meaningful work that contributes to the health of individuals, communities, and our planet. It means everyone can access the care they need without fearing they'll go bankrupt to do it. So any proposal that Indivisible supports and will embody the 5 principles outlined in the People's Bailout. Next slide, please. So 1, protect our democratic processes while protecting each other. 2, make health the top priority for all people with no exceptions. 3, provide economic relief directly to the people. 4, rescue workers and communities and not corporate executives. And 5, make a down payment on a regenerative economy while preventing future crises. And you'll see that throughout our response to the COVID-19 crisis. Recently, we opposed the 3.5 package because it did not meet all of our 5 principles. Next slide, please. So these are some action items that we would like you to bring back to your groups. And we'll send out an email after this with all the resources and a recording of this webinar. So first, call your members of Congress and demand that they support a people's bailout. And after that, send a letter to the editor and record a video. And as I said, this is very new, so I'm sorry I didn't make it onto the slides, but we're going to be asking you to call your members of Congress, specifically your reps, and demand that they sign the People's Pledge. Sorry if that's not quite the wording. Again, it's very new, but this is so that to ensure that COVID Package 4 has all the things that we need to create structural reforms and benefit everyone. 2, call your senators specifically about election funding. As we saw, what happened in Wisconsin cannot happen across the country in November. We need more funding for vote by mail, extended early voting, and PPE for election day workers. 3, call your governors, state reps, and secretaries of state to implement equitable responses to the COVID-19 crisis. So in addition to advocacy on the federal level, there's so much you can do in your own state to organize against structural inequality. So many of the programs passed on the federal level are actually implemented by the states. So things like SNAP benefits, unemployment insurance. And so that means that there are many avenues to increase access to these necessary policies and programs. And this applies as well in blue states. So if that's something that you're interested in, but need a little bit more support, Indivisible's policy team offers scaled support to groups who want to pursue change on a state level, but might need some help with policy analysis and resources or tools just to get going. And if you're interested in that, again, we'll send out more information. And 4, RSVP for the Warren Khanna Zoom rally on the Essential Worker Bill of Rights. So if you're watching this as a recording, this Zoom rally might have already passed, but definitely read up on the Essential Worker Bill of Rights and send in a video about why you would like to see it adopted on a national level. And we will again send out more information about that. So that's all the action items that we have for you today, and we're going to move on to our Q&A. So
actually, one quick update for the Warren Khanna rally. It was supposed to be yesterday, I believe, but since Senator Warren's brother died, I think it has been postponed until next Thursday. I think I saw an update about that. And I think we're right at time.
Oh, okay.
Yeah, so I think we should say thank you for your patience. I think we should thank everyone for their patience, for our technical difficulties, and we're just hoping everyone follows through with those action items. And what we would like to end on is the poll that we had, that you do have some more time. These are some of the responses to the poll that you've already responded to. If you've only had 48 hours of breath left, what kind of world and what kind of policy would you fight for? And there were such good responses here. We just thought we might leave you on this note and say thank you on behalf of Indivisible. And Judy, Ashley, and I would like to thank you for joining us. And as you take a moment to look at your colleagues and the kind of things that they would like to, the policies and the kind of world they would like to fight for, the poll is still open. You can take a moment to add your response to the poll and as you leave. And we'd like to say thank you. Have a good day.